So what happens to synapses when you develop insulin resistance? How does this impact the proliferation of Alzheimer's?
Yeah, good point. So what happens is insulin binds to the insulin receptor, and the major molecule downstream from that is called IRS1. And IRS1 gets phosphorylated. When you're signaling positively through the insulin receptor, the IRS1 gets tyrosine phosphorylation, and there's low serine and threonine phosphorylation. So that's on. That's signaling positive. That's signaling survival. That's signaling metabolism. That to deal with the glucose that's being metabolized. On the other hand, when you have this chronic increase, you've had a high carb diet, you've got this insulin that's up there for so long, then in fact you develop insulin resistance. Now what happens is the tyrosine phosphorylation is going down, and now the serine and threonine phosphorylation, especially at specific residues, goes up. And so this is a little bit like, imagine that every day you come home and your son is playing the drums really loud. So you're putting on earplugs, right? You don't want to hear this. And now what happens is your wife come home, you've got the earplugs on, and she puts on a Brahms lullaby. You can't hear it. So this is exactly what's happening with insulin resistance. As you now start to lose the ability to make enough insulin because you're way high for years, then in fact, now you're unable to signal. You're not getting that trophic support that you should be getting from this. And therefore, we like to look at the HOMA-IR, which is telling you how much insulin resistance you actually have. And we want to get their HOMA-IRs to be optimized down around 1.0. We see people all the time coming in with HOMA-IRs of 3, 4, 5, even higher. And these are telling you have a lot of insulin resistance. You are increasing your risk for cognitive decline.
What types of mental activities should we be doing to help prevent dementia? Should we do puzzles or read a lot?
Yeah, it's a good point. You don't want to go to the point of giving yourself a lot of stress, because stress actually is another thing that causes this downsize, unfortunately. And so this is good. And I should mention before we move on, also, poor sleep. One of the things we haven't talked about, it's a huge issue. Poor oxygenation during sleep, huge issue. And of course, stress can make people wake up in the middle of the night, huge problem. So what we want to do then is to get people to have optimal, outcomes where we minimize their stress and we improve their overall signaling. So this is a critical issue. So as I said, you want to make sure that you don't have super amount of stress, but the actual brain training itself is helpful. And again, this has been controversial because people have said, well, what if you just do this one thing? This idea that any one thing is the optimal is kind of silly and reductionist, not helping. We want to be able to look at an optimal overall approach, and brain training is helpful. Now, people have talked about, should this be puzzles? Should this be learning a new language, learning a new instrument? Any of these things can be helpful. However, let's look at where the data are. There are published data, mostly from one type, which was set up by Professor Mike Merznick years ago, and this is called Brain HQ. So these other things can be helpful. We just don't have as much data yet. We recommend that people try Brain HQ simply because we know that the data support a reduced risk for cognitive decline and an enhanced improvement when you use that approach. And so you are driving your brain, but again, you don't want to do it so much. And so we recommend if it's very fatiguing and stressing, start with a small amount. Start with 5 minutes a couple times a week. Work yourself up to the point that you can do 30 minutes 3 times a week, or even 15 minutes 4 or 5 times a week. That will help. And think about things that enhance your speed. There's one that they have called Hawkeye, another one's called Double Decision. They've published some nice work on double decision. So these are the sorts of things that are helpful. But yes, absolutely, if you like Sudoku, if you like learning new languages, these things can all potentially be beneficial. We just have fewer data points on these.
Are certain minerals a cause of Alzheimer's, such as copper? Should we avoid certain nutritional supplements
Yeah.
because they have minerals in them?
Yeah, this is a very good point. That again, all things we have to get the optimal, and so most things in biology, too little not good, too much not good either. The bad actors in Alzheimer's, mercury is the big one that we really have to be careful about. It is the most common one that high levels of mercury do literally give you the pathology of Alzheimer's disease. Others can contribute because they are making it, they're damaging your detox and they're making it more that you've just got the total amount of toxic burden is an issue for people. So they can enhance the problem that you have from these other toxins. And yes, copper is a big one. High copper to zinc ratio, often associated with overall toxic burden. And it's been pointed out that we tend to have exposure to too much copper and too little zinc. There are about 1 billion people on the globe who are zinc deficient. It's one of the most common deficiencies, unfortunately, and that is associated with cognitive decline. So these are all important. Magnesium, another common one, and both zinc and magnesium critical, by the way, for insulin function and for keeping us out of type 2 diabetes. So these things, again, all work together. And yes, these can absolutely be, and then these can absolutely be increasing your risk. And so also lead and other metals, arsenic, very, very common, and they can contribute, although again, they're not as commonly the dominant one as mercury is.
What molds are the main ones that are linked to Alzheimer's?
It's a good point that if you look at all the different toxic cases of Alzheimer's, the biotoxins seem to be the most common. Again, that's not to downplay things like mercury, where there are very clear evidence. And this another area that has not been accepted by the general medical community, and yet we're seeing it again and again and again. And we see that when people have mycotoxicity associated with cognitive decline, they don't get better until you reduce those mycotoxins. And first published this back in 2016. It's been very clear, thousands of cases. And it's been known for years that people who have mycotoxicity can often have some brain fog. It wasn't clear that they actually developing Alzheimer's. But again, think about it. Alzheimer's, you're dealing with insults. You're making this amyloid that is actually an antimicrobial, and it does have an antifungal effect, among other effects. And so therefore, it's not surprising that people who have these mycotoxins would ultimately develop Alzheimer's disease. Again, continued exposure to these is a big problem. We want to identify these. We want to remove that exposure as part of getting an optimal outcome. And these come in numerous different types. So there's trichothecenes, ochratoxin A, gliotoxin, things like this. And these not only damage your neural system, but they also damage other systems. And one of the big ones is they have immunotoxicity. So these molds are normally going to be dealt with by your adaptive immune system. So of course, they want to reduce, and they produce factors that reduce your ability to get rid of them so that they can actually live with you and in you, and they can be there in your sinuses chronically, as people know. They can be in your gut, for example, and so numerous. And of course, they can live in your brain as well. And if you look, and pathologists have done a nice job looking at the brains of patients with Alzheimer's, and what do you find? You find bacteria, you find things like P. gingivalis, you find viruses like HSV1 or HHV6A, you find molds, you find even yeast like Candida and things like that. So you find these different organisms in the brains of patients with Alzheimer's disease. So no surprise that these toxins are things that are associated with cognitive decline and that we need to treat.